Minister of Health Kweku Ajimamenu has commended the World Bank for its swift support to the country in the response and management of the COVID-19 pandemic. Mr. Ajimamenu made this pronouncement when the regional vice president of the World Bank in charge of West and Central Africa, Usman Diagana, visited the Fevers Unit and the Treatment and Infectious Disease Center at the Kolebu Teaching Hospital.
When we started fighting COVID 2020, Kolebu ICU had only 6 beds. And we couldn't bring our patients to Kolebu. They were always full. So you have to look elsewhere. In the process, we have to dedicate a brand new hospital that we have done for general services, dedicated to do infectious diseases. And then the private sector people also contribute to put about 100-bed capacity close to that unit. That has helped it so much in our country.
Mr. Diagana also visited the COVID-19 vaccination center set up with the aid of the World Bank. A total of $435.8 million has been committed by the World Bank to support COVID-19 response in the health sector. Mr. Ajimamenu disclosed that there are still some COVID-19 vaccines in stock to be administered.
Almost all the J&J that came initially, we have ordered so much, and we still continue to expect deliveries through to next year, 2023. So vaccines, we now have over 10 million stock sitting there. We have administered close to about 60 million. Some quite sizable number first dose. We have had about 4.something million second dose finished fully, and we are now getting into booster system. We are now changing the initial regime that we started with the protocols.
Mr. Diagana commended Ghana for putting the resources into good use. From the Kolebu Teaching Hospital, the Vice President of the World Bank visited the Ghana Tech Lab and the Innovation Hub set up in June 2018 at the Accra Digital Center, where 5,500 young people are being trained in digital skills. Minister of Communications, Esla Owusu-Ekufu, expressed satisfaction with the World Bank's support.
I keep saying that if we give our young people the digital skills that they require today, they will provide the human resources for the global world of work in 20 to 30 years. And I think with what we've seen today, just a little exposure to digital technologies, innovation, and skills. They're doing amazing things. Several hundreds of jobs have already been created, and it is the way to go. And so we'll continue to do what we can with their assistance and the assistance of other development partners and private sector organizations to scale it up so we can reach even more young people.
Some beneficiaries spoke to the Ghana News Agency.
We are trying to develop a mobile app that will help in solving some of the national problems. And specifically, we are tackling the 4 major prevailing diseases in Ghana, or maybe the communicable diseases in Ghana, such as diabetes, hypertension, and pneumonia and diabetes. So what we intend to do with our app, or maybe idea, is we wanted to create this app. So this app can be able to have more like a social platform, where which will have pharmacy on board, doctors who are specialized in those 4 communicable diseases, and we'll have education tips, and as well as BP tracker as well.
We give them the chance to identify a problem in their respective society or community, or as a country at large, that they think they can help solve through mobile app development. And mobile app development now give a convenience or accessibility for people to address such issues. So what you saw is one of the products or services that one of the business or startups want to undertake to solve. So there are some doing in tourism, some doing in health, some doing in agri, some doing in finance, some are also focusing on edtech, some are focusing in insurtech and all that.